Hello everyone, welcome back to my channel. This is RN Sakshi. So in today's video, I'm going to discuss about physiological integrity, which is the last category of the client need areas for your NCLEX-RN. So let's get started. So for physiological integrity, I have drawn this pie chart in which we can discuss 4 subcategories which fall under this one. So first one is basic care and comfort, reduction of risk potential, physiological adaptation, and pharmacological and parenteral therapy. So we will be discussing that what topics fall under these subcategories. So first one here we have is basic care and comfort. So for the basic care and comfort, we have 6 to 12% of proportion which will be coming in your NCLEX-RN. So the topics which can be covered here in this are activities of daily living, assistive devices, wheelchair, canes, walkers. So NCLEX loves this, which is known as, also you can call them as ergonomics. So sometimes like students don't know what are the ergonomics. So ergonomics is which deals with all of the assistive devices like wheelchairs, walkers, canes, and all that stuff, right? And there will be separate video which will be discussing in brief. Then we have hearing aids, prosthetics, dentures, positioning, right? So from basic care and comfort, we can acknowledge that the nurse is responsible for providing care. Like we can assist the clients in their day-to-day activities, or like sometimes clients require assistance for walking, for moving, right? So these are some of the topics which can be covered in that. Then we have is elimination. All of the basic physical necessities can be covered in this topic. So in elimination, like voiding, ear irrigation, right? Mobility and immobility. So like we have discussed, like some of you who are preparing for NCLEX-RN, you can easily tell that what I mean from mobility or immobility. That means, skin erosion, skin breakdown, right? Taking wound cultures and all that stuff, like friction, right? So like if the client is not moving, if the client is stable on the bed, then the skin integrity can be despaired, right? So these are some of the topics. Then is non-pharmacological comfort measures. So in non-pharmacological comfort measures, that means like a client is suffering from pain. So not all, like there is a pain scale, right? So we always ask the client that rate your pain from 0 to 10, right? 0 being no pain and 10 being the most excruciating pain which you have suffered, right? So according to these, sometimes if the client says I only have pain 3, right? From the 0 to 10 scale, he says like I only have rating of 3, right? So sometimes we use non-pharmacological comfort measures like aromatherapy, acupuncture, supplements, right? So music therapy. So these are some key topics which can be covered in your basic care and comfort, and some of the questions can be arrive in your exam as well. Like they can ask you that like for example, they can give you a scenario like patient is not suffering from that much excruciating pain, so what nurse can suggest other activities. They can give you 4 options. One option can be guided imagery, right? We can discuss all these therapies in our separate video. Then is nutrition and oral hydration. That also comes in your basic care and comfort. Of course, basic care, right? So nutrition and oral hydration means like edema, right? Signs of dehydration, body mass index, tube feedings, electrolytes, right? Low sodium, increased protein intake, in which patients we will give the protein, in which patients the protein will be contraindicated. Maybe they are suffering from renal disease, so sodium will be contraindicated, protein will be contraindicated, right? So that kind of things. Then calorie counting. Is the patient able to chew or swallow, right? Maybe we can assess these kinds of things. Why? Because of risk of aspiration. This is your critical thinking, which we'll be discussing in other videos, that why these things are important to assess, right? In stroke patients or something like that. Then we have is personal hygiene, shower chair, handrails, post-mortem care, right? So there can be questions based on these topics as well. Rest and sleep, activities to promote rest, right? So each and every topic have their own importance, but you know, these assistive devices, activities of daily living, right? Positioning, your skin breakdown, mobility, immobility, right? Elimination, these are important topics. They seem to be very easy, but sometimes, you know, questions can be very complex. They require your critical thinking. The next category here we have is pharmacological and parenteral therapies. So from the name, most of you can understand that it consists of medication administration, dose calculation, which is the most, you know, a fearful thing for most of the nursing students. We can prepare the video for this topic in the next video. So dose calculation is the must. So of course you can get 1 or 2 questions on dose calculation. Then adverse effects, contraindications, side effects, allergies, blood and blood products. In this topic we can cover about blood transfusion. So there is a different scope of RN and different scope of LPN. So don't get confused. So the questions can be based on that topic, right? So like questions can be differentiated. So because the scope of practice among both categories is different. So we can make the different video for that one as well. CVDs, your central venous access devices, and your expected actions, outcomes, like what nurse should do. Parenteral therapies like IV, right? And your pain management, how the pain can be managed, like narcotics or these non-pharmacological therapies which we have discussed earlier. Then your TPN. TPN means your total parenteral nutrition. This is also an important topic because there are some complications for that as well. So we can make the other video on other videos, right? Then we have is your reduction of risk potential, the third category. So reduction of risk potential, from the name we can understand that we have to reduce the risk, right? So reducing the risk of complications to pre-existing disease. So treatment and procedures are also covered in this one. Like if the client have undergone under any treatment, right? For example, cardiac catheterization. So what will be the nursing interventions which can decrease the complications, right? Immobility, they have to straighten up their leg on which the cardiac catheterization procedure have been performed, right? So these are some things which nurse should always critically analyze, right? There can be questions, right, in which some interventions can be like elevate the head of the bed, right? Positioning. Then your immobilized extremity, as I have mentioned the earlier example of cardiac catheterization. So changes in your vital signs. Then diagnostic test, lab values, therapeutic procedures, and complications in surgeries. So we have to decrease such complications, right? For example, we have to monitor for thrombocytopenia, right? So patient have just arrived from surgery. So what will be the most important nursing intervention to assess, right? So these kinds of questions can be, you know, formulated in such a way. So in diagnostic tests, we have ECGs, non-stress test, glucose monitoring, fetal heart rate, ultrasound, CT scans. So there can be a, you know, separate topic. So this is a separate topic which requires your brief explanation and brief study. So we will discuss about that in another videos, and your amniocentesis as well. So, you know, changes in vital signs is a big thing. It's a critical thing, right, for the nurse, because the patient was stable, but suddenly there are changes in vital signs, right? So that's a big deal. So these kinds of questions can be highlighted in your NCLEX-RN. So you need, your proper knowledge, your facts should be cleared, right? Then assess client from diagnostic procedures like dysrhythmia following cardiac catheterization, right? So that's the big thing. Maintaining urinary catheter, NG tubing, chest tube, anti-embolic stockings. These all topics fall under this reduction of risk potential because we are trying to reduce the complications. As anti-embolic stockings, right? So why are they formulated? Why the doctor advice for them, right? Because of clot formation. So these are some kind of things like which should be always cleared in your mind. So in other videos, we will be discussing that how these facts like apply. If you have knowledge, if your facts are clear, then for sure you can, you know, eliminate at least 2 options in your question. Then is circulatory complications like hemorrhage, emboli, thrombus, clot formation and all, right? These are circulatory complications. Neurologic complications like foot drop, right? So what will be done for managing foot drop and all, or preventing foot drop, numbness and tingling, right, in your nerves. So that's also related to your neurologic complication. Specific assessments like fall assessment. NCLEX loves falls. So fall assessment, how the fall assessment is being done, what is the criteria, what should be checked, right? So these all topics we will be discussing gradually. Then skin integrity, right? Then your Glasgow Coma scales, level of consciousness. So therapeutic procedures like log rolling, right? So why log rolling is being used for the patients, right, who have their head injury or something like that. Then abduction pillow, like the patients who have gone under hip replacement surgeries, right, knee replacement surgeries. Then monitor client after casted extremity. You know that, right? Circulate, like their circulation is the key, right? If, for example, the client has a cast on their leg, so what the nurse will monitor, right? So these are some things, right? So like there are 6 P's which we have to monitor, that either there is pain, pallor, paresthesia. So these are some kind of things, like if your concepts are being cleared, then you can easily pick the answer from your question, that what question actually is asking, right? Then your continuous bladder draining, wound drainage, sedation, all of these topics fall under this category. So the last one we have here is physiological adaptation. So in that we have alteration in body systems like drainage, amount and color. For example, if there is a wound, right, there is a drainage coming out of the wound, how much drainage it is, what was the color of the drainage, right? Then radiation therapy, phototherapy, eclampsia, increased ICP. Increased ICP is also a big deal. So then ventilator, of course, you can expect at least one question on ventilator as well. And like negative pressure wound therapy, we will be discussing it. And then ostomy care, bronchoscopy, all of these procedures. Fluid and electrolyte imbalance like sodium and water, potassium, chloride, magnesium, calcium, right? So there can be a question like hypo or hypernatremia, all of like, so what the diet will be excluded for the hypernatremia patients, like avoid sodium, right? So these kinds of questions. And sometimes question arises like, if the patient is suffering from hyponatremia, what will the nurse assess first? She will be assessing for seizures, right? Because of these things like cerebral edema, right? So these are some concepts which I'm trying that you should know. These should be on your tips, like hypo or hypernatremia patients. Maybe if the sodium is getting altered in your body, of course the patient is at risk of seizures, right? So these things should be, in your mind always. Hypo or hyperkalemia. So if potassium levels are getting low or high in your body, so you should always be acknowledged that maybe ECG changes, right? Always. So there are some tricks to remember those ECG changes for hypo and hyperkalemia. Then is pathophysiology, of course, immunity and cellular repair. Medical emergencies, we have to sometimes, CPR, right? Your defibrillation. So restoration of breathing, pulse, and wound dehiscence. Wound dehiscence means separation of the wound, right? That's also a big complication. Sometimes you can expect question on that as well. Unexpected response to therapies, for example, UTI, that is urinary tract infection, or your increased ICP. Then is hemodynamics, telemetry, pacing device, arterial lines, ventricular fibrillation, sinus bradycardia, tachycardia, which we will be discussing in our ECG lectures. So hemodynamics means sometimes students doesn't know about what hemodynamics actually says. That's in simple language, it means circulation or the flow of the blood, that how the blood flow is being in your body, right? So it only deals with the circulation of the blood. That's the simple definition of hemodynamics. Then is illness management. Of course, we have to manage client recovery from illness. Like if the client is sick, of course, we have to deal with their recovery and rehabilitation. So that was all under this physiological integrity, pretty much easy, but we have to be, very quick, and we have to be very factual related to these such topics. In upcoming videos, I will be making content on all of the important topics which are like in which maybe you will expect question in your NCLEX-RN. Then we have is a sample question here. So let's read the question. Nurse is assessing a client scheduled for lumbar puncture. So in this, guys, you should know what the lumbar puncture is. So lumbar puncture is a diagnostic procedure in which the needle is inserted into your spinal canal to take the sample of the cerebrospinal fluid, in the simple meaning, right? So I have drawn a diagram over here so that you can be easily clarified. So these are your vertebrae, okay, and then this is the needle, and this pink boundary which I have drawn here is your CSF, the fluid which is in your spinal canal, that is known as cerebrospinal fluid. So needle is going to take the sample of this CSF, right? So this is the cross section of your lower spine. So why this lumbar puncture test is being done? So lumbar puncture test is done for maybe your client is having meningitis, or there is a suspected case of subarachnoid hemorrhage, right? So we have to undergo this procedure so that we can rule out that from which condition the client is being diagnosed. Then, so the question says the nurse is assessing a client scheduled for lumbar puncture. It would be most important for nurse to assess client for. So read the question again. I will suggest read it until you understand. So nurse is assessing a client scheduled for lumbar puncture. It would be most important for nurse to assess the client for. So most important means priority, okay? So let's read the options. Option A, bowel and bladder function. Option B, presence of Trocheus sign. So let's, okay, side by side we will just deal with one option only. Option A, which is bowel and bladder function. Okay, like if you don't have knowledge, okay, we can just, you know, take it from side that okay, we can consider it. Okay, option B, presence of Trocheus sign. So you know that why it's here, the Trocheus sign is in the hypocalcemia, right? So if you have knowledge, see, I have already mentioned like fluid and electrolyte imbalance, right? So you can easily eliminate this option that this is not an answer as it deals with hypocalcemia, and we are talking about lumbar puncture, right? Option C, increased ICP. So lumbar puncture, meningitis, critically think, meningitis, subarachnoid hemorrhage, that deals with brain, right? So it's also related to brain. So we can do it as 50-50, right? Okay, we can consider it. Option D, circulation of legs. Lumbar puncture is done in your spinal canal, right? We can consider it, but still, you know, circulation of legs, we have not done any like there is no any cast or something like that, there is no surgery done on the legs, so it can be eliminated for this time as well. So at least two options you have eliminated. Now we are only left with these two options. So for picking up the right answer, you should have your proper contextual knowledge. So what does this say is nurse assessing a client scheduled for lumbar puncture, right? So I have already told you that the needle is being inserted into your spinal canal to take the cerebrospinal fluid, right? So read the question properly again. The client is scheduled for, like the client will be undergoing for lumbar puncture. Still the lumbar puncture is not being done, okay? So bowel and bladder function can be assessed after that, right? So in this is very critical thinking question. Why? If the client have increased intracranial pressure, we cannot do lumbar puncture. So that's why option C is an answer, because if the client have increased intracranial pressure, the lumbar puncture will lead to brain herniation. That means brain death. Okay, so this is the fact which you have to remember always, that if the client is having increased ICP and doctor has said that okay, so you know, maybe we have to do the lumbar puncture on the client, but nurse finds that ICP is being increased, so she will say, hey doc, we cannot perform the lumbar puncture on this client because it can lead to brain herniation or brain death, in simple terms. because it can, compress the spinal canal, right? And then circulation can get impaired to the brain, and it will automatically lead to brain death. So the question arises here is, we will be discussing these topics in our separate video. I'm just, clarifying your just theory here. So how the nurse can acknowledge that client's ICP is being raised? There are just 3 things, which is known as Cushing's triad. Always remember this in your mind, Cushing's triad. That means increased BP will be increased, pulse will be reduced, that means bradycardia, and your respirations will be irregular. If these 3 things are there, then means it is leading to increased ICP. And if ICP is being increased, we cannot do lumbar puncture. Why? Because of brain herniation and death, right? So these are some critical analysis questions which you will get in your NCLEX-RN, and for that you have to be thorough, you have to be on your tips for your theory. That's not like you have to cram the things, but as we will just start, our syllabus, and once we get progress, your your doubts will be cleared, your facts will be clear, and learn the elimination method. If you are going to give your NCLEX-RN, just try to learn the elimination method. That will be best, and it will help you to pick the correct answer. I hope you like this video, and I will be making more, so stay tuned. Please feel free to contact me for any kind of queries. So thank you for